You are walking toward the refrigerator with an ordinary spoon in your hand. You think, yesterday's leftover rice, jingly vegetable, or used oil, just heat it up and eat it. You assume that once the food has been heated thoroughly, all the bacteria are dead, the toxicity is gone, and you are safe. This assumption sounds very logical. It does not even seem like a mistake. And that is exactly why, week after week, it can cause silent damage in your kitchen by gradually forming compounds that harm your cellular health and long-term wellness. Today, I will talk about 3 specific food categories that, according to documented evidence, become risky after reheating. The risk of food poisoning is real. The risk of cellular toxicity is real, and each food has a different mechanism. It is important to understand all 3 because even if you follow a healthy diet but routinely put the wrong things in the microwave, it creates a contradiction that perhaps no one has explained to you before today. First food, cooked rice. Rice is the most widely consumed staple food in the world, and reheated rice is perhaps the most common household leftover. When rice is cooked for the first time, the spores of Bacillus cereus, a bacterium naturally present on raw rice, survive. During storage, when the rice cools slowly at room temperature or is kept in the refrigerator after a long delay, these spores germinate and the bacteria begin to grow actively. Now, the problem is that reheating may be ineffective against these spores. So, the presenter kills Streptococcus in that specific ratio, and this is the intensive detail of the first food. For accurate information, you should first seek guidance from some books. Second point, in the bacterial aspect of reheated rice, Bacillus cereus produces an emetic toxin and a diarrheal toxin, and these toxins are heat stable. Once they have formed, they do not break down at normal reheating temperatures, whether the rice is heated in a microwave on a stove, heated once, or reheated again. The purpose of reheating was supposed to be to kill the bacteria, but it leaves the toxins unchanged. Therefore, reheating may only reduce the bacteria, while the toxins remain present. This is what causes fried rice syndrome, or food poisoning from reheated rice, which can lead to vomiting and severe diarrhea. Therefore, it is essential to refrigerate rice, and leaving reheated rice uncovered in the sun can create a serious risk. Soybean oil, radish ghee, or ghee, these oils are often used by us in everyday practice. When reheating them, we often fry chips in them, use them repeatedly, or reheat food cooked in them. That is a separate issue. Once oil has already been cooked at a high temperature, reheating it again at a high temperature keeps it in contact with oxygen for a longer time. This degrades polyunsaturated fatty acids and produces toxic aldehydes such as 4-hydroxynonenal and melandialdehyde. Regarding aldehydes, the phrase about the university, breast, dairy products, and printing is unclear in the original. These aldehydes have been found in vivo studies to cause oxidative damage to cellular structures. Therefore, when you repeatedly fry food in the same oil, fry one batch after another every day, and then continue using it after you expose yourself repeatedly to aldehydes. This supports the hypothesis of cellular inflammation. All of this has also been associated in studies with toxicity that may affect hormones. Third food, spinach and similar leafy greens such as fenugreek, mint, mustard greens, and beet greens. All of these are natural sources of nitrates. Nitrates on their own are normal, and they can also be beneficial when consumed fresh and raw. However, they may become dangerous under certain reheating conditions. When these leafy greens are cooked and then stored in the refrigerator, bacterial activity can convert nitrates into nitrites. When these nitrites are exposed during reheating, they may react with amino acids under heat and form nitrosamine compounds, which are listed in a probable carcinogenic category, according to the International Agency for Research on Cancer and the World Health Organization. These substances may cause DNA damage in vitro. However, remember this important disclaimer. These compounds are not usually present in food at levels high enough for daily exposure to create an immediate risk of cancer. Nevertheless, it remains established that cumulative exposure may have potentially toxic effects at the cellular level. Now, here are some remedies and practical actions for all these issues that you can include in this video and apply in your kitchen every day. First, always store rice fresh in a shallow container. Refrigerate it within 1 hour. Apart from this, do not place reheated rice directly. After reheating, do not leave it sitting out, eat it immediately. This is important because reheating does not reduce bacterial toxins. If stale rice has been kept overnight, it may make it possible for salmonella to enter your body. Also, do not keep the remaining rice improperly. Second, do not innocently keep using the same oil or ghee repeatedly for frying in the same quantity. Minimize reusing oil a second time after it has already been used once. Use fresh oil when sautéing vegetables. When reheating food, discard oil that has become diluted or mixed into the dish and use fresh oil or butter instead. Third, always eat leftovers of cooked spinach, fenugreek, or mustard greens cold. Within the first 4 to 6 hours, add them to a salad, use them in a sandwich, or add them to a cold appetizer and store them directly. Avoid reheating them, and it is best to keep them raw before cooking fresh. Above all of this, there is one main point. This video is not meant to suggest that you should never eat leftovers or completely change your diet. The purpose of this video is to help you understand that you should have kitchen-level awareness about whatever you reheat because bacteria exist, oils degrade, and nitrates can convert into other compounds. All of this is evidence-backed information published in public health journals and supported by material from EFSA, the WHO, and peer-reviewed cancer journals. You may choose to ignore any one individual study, but when 3 different sources converge on the same point, it becomes noteworthy. Speak with your doctor or nutritionist if you would like to verify these concerns. However, making even one behavioral change from today, such as no longer leaving cooked rice out in the sun or discarding used cooking oil, may make a measurable difference to your long-term health exposure. And that is the practical takeaway from today's video.